Hello everyone. I would like to introduce myself before starting the discussion. I'm Dr. Jaspreet Kaur, MBBS MD in Biochemistry. I did my MBBS from Lady Hardinge Medical College, MD from UCMS, and my senior residency from Maulana Azad Medical College. I have been teaching for about 18 years the dental and medical students. Now, coming to the topic of discussion today is vitamins. Now, as we know, the nutrients are divided into macronutrients and micronutrients. The topic for today, vitamin, is a micronutrient. Now, why is this known as micronutrient? It is required in very small quantity. It is an essential dietary factor. As we know, the enzymes, they require cofactors, and the vitamins, they function as cofactors, and being organic in nature, they are rather coenzymes, or the enzymes linked together, they both are known as holoenzymes. Example is pyruvate carboxylase, which requires biotin to become active. Now, they are chemically unrelated organic compounds. As we see, vitamin B complex, it has heterogeneous organic compound B1, thymine, riboflavin, niacin, pantothenic acid, ascorbic acid. They all are categorized into B complex. They cannot be synthesized in adequate amount. So they have to be taken sufficiently in our diet so that we don't develop deficiencies. Now, the time of onset of symptoms is a function of the size and the daily flux of the body reserves. So, the deficiency symptoms, they develop according to the need of the body. So, coming to the conclusion that vitamins are organic compounds that human tissues cannot synthesize but are required for normal growth and development and must be included in the diet. Now, vitamins are conventionally classified as water soluble and fat soluble. As we know, water soluble, they are heterogeneous organic compounds and they are 9 in number. When taken in excess, they are excreted in urine and hence they are non-toxic. Whereas fat soluble, they are 4 in number. They are transported in our body with the help of fats and they are stored in liver and adipose tissue. If taken in excess, they lead to toxicity, hypervitaminosis. As a function, the water-soluble vitamins, they are precursors of coenzymes. Fat-soluble vitamins have varied functions in our body. They are antioxidants. They function as hormone. Vitamin K is the only vitamin, fat-soluble vitamin, which functions as coenzyme in our body. Coming to detailed classification of water-soluble vitamins, they are classified as non-B and B complex. The non-B has only one, that is ascorbic acid, also known as vitamin C, which actually everyone is consuming these days as it is an antioxidant and it is a preventive measure taken by all of us these days against COVID. Now, B complex is further classified as energy releasing, hemopoietic and others. The word energy releasing itself signifies that it is involved in metabolic processes in our body. So under this we have 5 vitamins. Number 1 is vitamin B1 known as thiamine, B2 riboflavin, B3 niacin, biotin and pantothenic acid. The second category is hemopoietic. As the word explains, it is involved in formation of RBCs. So folic acid and vitamin B12, also known as cobalamin. It contains cobalt. In others, we classify vitamin B6, which is known as pyridoxine, pyridoxal and pyridoxamine. Thank you.